think I'm live. I know in all my videos I have some time where I'm doing nothing, and it's because Facebook sometimes can be a little bit confusing when it live is actually happening. Okay, I think I'm live now. So I was just thinking, I get asked quite a bit actually, what is it like for me as a therapist, as a psychologist, to sit and hear people's stories and what they're going through and their traumas and their grief and their loss? And how do I sit and deal with it? And am I just sitting there thinking, oh no, like that person's crazy? And so I wanted to just take a few minutes and talk a little bit about my experience and what that's like for me. So, for those who don't know me, my name is Dr. Morgan Levy, and I'm a licensed psychologist in Florida. So, yes, therapists have emotions. We're human too. When we sit and we hear the stories, of course, we're going to feel. It's natural for us to feel responses, and part of the way that I work is to not necessarily hide what I'm feeling, but to share the experience, because it's really likely that what I'm feeling is similar to what the client might be feeling, and it might be hard for them to even recognize what they're feeling. So sometimes when I share it, it's easier for them to access those emotions too. I've never ever in a situation felt like it's hopeless or that a client doesn't have the capacity to feel better or to make changes in their life. That's never been the case. Um, so I've also been asked, like, does that really significantly impact me as a person? And it's therapist burnout is completely real. Compassion fatigue is real. It happens in a lot of the helping professions, and it's important for us as therapists to know how to make sure that that doesn't impact our work, because our goal is to help our clients, help our patients, to not be in a position where our client or our patient feels like they have to then caretake us, because it's also really likely they feel like they have to be the caregiver in their own life on a daily basis. So therapy is not the place for them to take care of us. So a few of the ways that I help work through emotions so that they don't come out and impact my work as a therapist. Um, my own therapy. I think it's very, very important for therapists to be seeing their own therapists, because we're all human and we have things that we have to work through. So that's actually one of my first pieces of advice to new therapists is be in your own therapy. You need to know what that experience is like. So in addition to that, I my own therapist, I also seek out in multiple areas peer consultation and peer supervision to make sure that I'm not necessarily missing something or need training in an area but that maybe I'm not an expert in, because I also think it's important for us to know our limitations and where we should be working and what we're capable in working through and what our limits are and when it's appropriate for us to refer out to someone who may be a better fit for our clients. And that's why I always recommend a free consultation, because it's not just for you to make sure the therapist is a good fit for you, but for the therapist to make sure that they have the skill set and the training to help you in whatever you're looking for. Okay, so my own therapist, peer consultation and supervision. So I do that in different ways. I do that in a group form, and I also seek out individual supervisors to help me with maybe like different clinical issues that I would want to work through. And also, all of that's always confidential. I never ever identify the people that I'm working with. That is very important, and that is the cornerstone of therapy. So, in case you were wondering about that, that's always confidential. So, also, my own self care. I work with my clients on them creating their own boundaries and self care. And, I think it's important for me to also do that for myself, because if I'm burned out, there's no way I'm going to be a good therapist for my clients. And so I do that in a few different ways, by reading, playing music, walking my dog. Sometimes my clients will hear about my dog, who can be very, very hyper and likes to climb trees. So I like to spend time walking her as my own self care. So those are just a few of the ways that I take care of myself to make sure that I'm the best therapist for my clients, because ultimately, if I'm burnt out and I'm experiencing compassion fatigue, I'm not going to be of use for anybody. So I hope that was a little bit insightful for you to hear a little bit about the behind the scenes of what a therapist is like. We're human too. And I know sometimes we're taught to keep all of that inside, but I think it's also important to see like that we're real people and we're also working towards things, but there's a way for us to do it in a professional manner so that we're doing the best work that we can for you. If you have any other questions, please feel free to leave a comment. And if you thought this video was informative, please go ahead and share it. All right, take care.